Hi there. For our group project, we decided to focus on the question of how do you balance healthcare accessibility with business sustainability? You see, we each came from different areas of Johns Hopkins and different academic programs, and we believe that the power of the Graduate Institute really rests in bringing collective minds from different areas of healthcare together to start to grapple with some of these big questions and challenges. We hope you enjoy.
Hi, my name is Sheena, and during the MPH MBA program, I've continued to work as a health equity advisor at USAID. My background is in international development and global health, and I've largely worked on health programs that are funded by US government and implemented overseas. Reflecting on my career, I think I've spent more time focusing on the healthcare accessibility side of the equation and ensuring that underserved communities were able to access tailored care and services. Through my graduate program and involvement in HBHI, I've been able to learn about the business aspects of healthcare, including financing and how to determine a program's return on investment, as well as the steps needed to build a shared vision of healthcare provision among diverse stakeholders with different priorities. I've also learned how to approach complex problems with both a public health and business lens, such as how to diversify clinical trial participation for diseases that disproportionately affect communities of color in the US in a way that is cost-effective but also addresses distrust in medical research and structural barriers to participation. As a future healthcare leader, I commit to making progress with equity in mind, knowing that each decision has an associated real cost and an opportunity cost. Collaborative partnerships that focus on reducing barriers to care, establishing a common vision, and making sure there's still room for innovation and growth will be key. Through my time at Johns Hopkins and my involvement in HBHI, I've developed the skill sets needed to tackle complex healthcare problems.
Hi, my name is Abby Soika, and before joining the Hopkins MHA program and HBHI, I graduated with a journalism degree and worked in corporate America for 7 years. I worked across sales, marketing, and finance, and I joined the MHA program eager to learn more about the healthcare industry and eager to innovate it. Now, with my foundation in business, I often thought about healthcare problems through the lens of a financial statement. Now, this education and experience in HBHI helped me widen this lens to see the complexities of the industry while understanding the systemic issues that impact individual and population health, as well as access to care. Yet we still find ourselves with this patchwork healthcare system that's trying to both serve our people and our capitalistic economy, which brings us to how do we manage business sustainability as well as access. Now, to me, keeping the finances sound and businesses sustainable seem like table stakes, but I believe we have to embrace creativity and innovation to think beyond standard payment models and traditional partnerships to ensure that access of care remains. Now, we heard from a lot of different people in leadership throughout our program, and I recently heard from the president of the Mayo Clinic platform, and he urged us as future leaders to be tolerant of risk so we can truly achieve innovative solutions. As a future healthcare administrator, I commit to being a mission-forward leader who prioritizes the rights and health of people. I will do this by fostering a positive culture, which I think is something that we as administrators can help manage and control. I want to give my team freedom to operate and empower our organization to tolerate the risk involved in making the future brighter for healthcare. And HBHI taught me that the only way to do this is to embrace, organize, and channel the collective genius represented by all the schools and programs in this institute.
Hi, my name is Shawn, and I'm a dentist and a graduate student at Hopkins. Previously, I viewed healthcare access and business sustainability as separate issues. But through my work with HBHI, examining telehealth during COVID-19 pandemic, I have learned to see the interconnections between these two elements. At Hopkins, I have learned that business models in healthcare can indeed align with ethical imperatives. For instance, telehealth not only expands access, but can also be a cost-effective model if integrated thoughtfully with traditional healthcare services. Challenges remain, such as ensuring equitable access across different populations and preventing the exacerbation of existing disparities. Moving forward, I'm committed to applying a dual lens of clinical insight and business acumen to navigate these challenges. By fostering innovative solutions like telehealth and advocating for policies that address both accessibility and sustainability, I aim to contribute to a healthcare system that values both human and economic health. A balanced approach to healthcare involves innovative and sustainable business models that do not compromise on accessibility. I'm excited to contribute to a healthcare system that effectively serves and sustains itself.
I entered the Master of Public Health program, interested in a policy career helping populations with the greatest health and social needs. While at Hopkins and affiliated with HBHI, I've learned that leaders in healthcare encouragingly share this goal, but can be limited by the priority of business sustainability. After all, if our laws and culture do not treat health as a right and treat health care like a business, we must care about how that business can serve all patients without sacrificing sustainability. Through my time at Hopkins, I've come to learn that often policy can be used to address two aspects of this challenge. The first is illustrated by the Maryland Total Cost of Care model. It shows how policies that incentivize healthcare actors to see all patients as whole persons and invest in addressing the roots of their health problems can shift the business proposition away from more care equals more money to high-quality, person-centered care that's more efficient equals more money. The second part of this challenge that policy can address are the laws and regulations framing health as a business. I hope that my policy career contributes to shifting the understanding of good health as a right rather than a privilege and establishes affordable access to certain services for everyone. In the wake of the ACA, I see Medicaid expansion and particularly creative use of Medicaid waivers as areas primed for this type of work.
Just wanted to say thank you so much for the opportunity for learning in the HBHI family. We look forward to continue to grow in partnerships, relations, and learning with you. Cheers.